Yeah, I was diagnosed with multiple sclerosis in around about 1997 after I lost the use of my hands and my mobility. Uh, it worked out that I probably had the MS for about 11 years before that and was misdiagnosed and treated for stress and put down to the work that I was doing. And when I was finally diagnosed, everything went pear-shaped. Since then I've got multiple chronic illnesses, which is not unusual for somebody with a chronic illness. Normally a lot of people end up with more than one. I've been asthmatic as a child. I've got high blood pressure, I've got cholesterol. And just to hit the jackpot, a few months ago I was diagnosed with diabetes 1. After I was diagnosed, what concerned me the most was medications, cost of medications, cost of living. My son was 12 years old at the time, was at a private school. We had a high mortgage, and not knowing from day to day what was going to happen with the MS because it's so unpredictable. And losing my job, I was in an industry where they weren't going to employ a person with MS because people don't really know about it. So that was a great concern for me. But living, just living, and what where I was going to end up as far as financially. Superannuation that I'd never employed money into superannuation, so I haven't got much to live on. So that they were pretty big concerns. Plus, as my neurologist said, if you're going to make any changes you make to the house, it's got to be accessible, and the cost of that is just prohibitive. My out-of-pocket expenses per month are around about $500. I'm on around about 15 PPS scripts a month at $5.80 each. That until I reach the safety net, because my health card I do get the reduced rate, but until I reach the safety net, it's quite an expense. I use a neurological painkiller, which costs me around about $70 a month. That's after a rebate from the health insurance. I also have a relaxant at night, which again is around about $50 to $60 a month. And there's also things like continence aids. And I'm looking around about $60 to $80 a month for vitamin tablets. And that's including calcium, which used to be on the PBS and was taken off the PBS. There are two medications that I can't afford to take. There's an anti-fatigue medication, which I work out is probably about $220 a month, and also there's a medication for mobility, which would be about $4,000 per annum. I can't afford those, and they're not subsidised.